Good evening and welcome to Health Check. This is your weekly live medical show for all things health and wellness. I'm very excited about today's topic because this is a topic that many people do not like talking about, and even less people do not really understand it. Now, miscarriages, this just is one of the things that any expectant mother wouldn't even want to talk about. But again, the loss of pregnancies is something that has affected so many people globally. And it is only important that we discuss it. It's only important that we dive deep into that conversation. And today, with the help of two amazing, young, beautiful women, I want to call them young because they're young at heart. We'll be getting into that conversation and, of course, learn the best way to help anyone who is struggling through emotional healing or even maybe depression that is associated with pregnancy loss. So I'm very much excited. And definitely, you can definitely WhatsApp us on 0708 222 or SMS at 20933. And of course, we are live on Facebook, YouTube, and also Instagram. You can also get us on any social media platform. We are live, and this program is definitely going to help you today, to help anyone who may be going through the situation that we will be addressing today on pregnancy loss. So share that link with a friend who may be needing it. So karibuni sana.
Thank you.
Thank you.
How are you doing?
We are blessed.
We are blessed. Yes. So with me here is Rose Talo and of course Jane Gatia, but I'm going to give you a chance to introduce yourselves. Tell us what you do and even why you're here today, what you will actually be highlighting. So let's start with you, Rose.
My name is Rose Salwa.
Mm.
I am a daughter, a wife, a mother, and a pastor by calling, training, and practice. I serve with CITAM, currently at CITAM Thika Town. Yes. I am here to talk about my miscarriages and what that made me feel. Yes.
Yeah, so you'll be sharing your story of hope with us today.
Yes.
And I get that you prefer the name Rosie.
Yes,
So I will
prefer
remember
Rosie.
that.
Yes.
Yes, Madam Jane, please let us know about you as well.
Thank you. Thank you so much, first of all, for this opportunity. Yes, I'm Jane Gatia. I'm a practicing counseling psychologist. I am also a part-time lecturer in the university. I work for East Africa Institute of Professional Counseling. So I counsel people almost on daily basis with all kinds of issues. And I also teach counseling psychology.
Oh.
And I thank God there's an opportunity
Yeah.
here to discuss a few issues that are pertinent to our own lives.
Yes.
Yeah.
And I believe they are definitely really important because, you know, as we are having a conversation, we brought out the fact that this is a topic that many do not like discussing. And some people don't even consider it a loss, as Jane, you mentioned. So maybe I can start with Rose Talwa. The name sounds South African. Do you have a South African?
Talwa is from Western Kenya.
Oh,
near
really?
Kakamega Forest.
Oh my God, it sounds South African, you know, Salwa.
Talwa, yeah.
Yes, but I do understand you've been through a series of miscarriages, two to be particular. Maybe you can share that with us. And how different were they, and how did that take an emotional toll on you?
Of course, I said I'm a mother.
Yeah.
So my first miscarriage was in 2019, June. Our third born.
Oh.
It was supposed to be third born. So it was, in fact, I was in church. It was after Sunday service. I was the one preaching that Sunday. And so I preached and it was well. And I went home. It was 9 weeks. Then I went home. On Monday morning, you know, for most pastors on Mondays, we don't work. We stay at home. We don't go anywhere. So I just felt pain and went to the hospital quickly because there was some signs of blood bleeding. And the first thing that the doctor, gyna, advised that we do was a scan. And I remember the sonographer saying, I can only see the remains of the baby. I think that was the most painful thing I've ever had. I felt, I don't know what I felt. At some point I went blank.
Oh.
I think that took a huge toll on me. I went into depression for a few months, around 6 or so, trying to understand, blaming myself, annoyed, and all those kind of things, thinking what I did and what I did not do. And when it is 9 months and below, you are hiding, you're not telling many people, as the saying goes in Africa, hide your chicks, do not count them or something like that. So that one was tough. Now, the second one was last month, July. I think it being a second experience, I felt pain, self-blame, what I did, what I did not do, but it was not as bad as the first one. I think this one I had learned how to cope around it.
Yeah.
I thought it was big. This one was 4 months.
Oh, wow.
It was 4 months. So many people knew it, of course. So the tough part was how is the pregnancy?
Yeah.
You still, it was immediately after first trimester. It wasn't easy, but we are here.
Yeah.
Yes, we are here. Yeah.
And we are talking of just a month ago.
A month ago, 7th of July.
It's very fresh.
Yes, I was actually graduating. We're graduating that Friday morning.
Okay.
I lost the baby 7 a.m. And 9:40, I was supposed to be at the graduation square.
Oh, wow.
And I was the student with the graduation speech for the graduating class.
Wow.
Yeah.
Oh, my goodness.
Yeah, it was a tough morning.
It
was a tough morning. Yeah.
Wow. But you're so strong because, I saw you and I'm like, you don't look like what you've been through. Yeah, but thank you so much for sharing your story with us. And I know that so many people watching right now are feeling that's my story. I mean, I went through that, and maybe they're still in that phase of not sure what to do or even how to go about it.
Yeah.
And that's why I would love to maybe take this question to Madam Jane here. And maybe you can just light the way on this particular issue of the importance of counseling when it comes to people dealing with pregnancy loss.
Well, that's a very important, first of all, observation. And I would like probably also to deliver my empathy to Rosie for having lost pregnancy that early. And maybe many other mothers and fathers who have lost their expected babies to come. Yes, this is not a very simple subject, even to bring on the show, but thank God for the courage at Hope TV that we can be able to talk about this, which is a rare subject in the marketplace. Yes, the role of counseling for mothers and fathers, we need not forget that there's also a father out there who was expecting to see a baby that they have fathered to come up and, hold the baby. So it is both parents, where both parents were actually involved and live together, or they are connected in a way. Yes, counseling helps in the sense that the person who has had a miscarriage, or has got even a stillbirth, because that's also another level where probably many of us do not think about, is to help the person. Counseling will help the person, at least talking about it. Within counseling, we allow the person who have experienced the loss to be able to express themselves, to be able to talk about their experiences. Lucy has just said she doesn't know what she felt when she got the news, when the shell was just broken, it's kind like pop, she didn't expect that. So there is confusion. There is, of course, that sadness. There is the self-blame. There's the guilt of what did I do? What was my role? Why did I go to that place? If it's about maybe there was a strain somewhere or something went wrong and all that. So there is always that mixed of feelings. And that happens whenever we get news that we didn't expect,
Yeah.
and especially news about death or loss.
Yes.
This was less loss, and it is also death,
Yeah.
because an upcoming life died prematurely.
Yeah.
So that kind of helping one to separate the feelings and even to own up to what they felt, to what they had, to what some people even say they started smelling something. Immediately they got that news, and the smell hangs on there. They say they keep hearing like a baby is crying, probably it is out of that confusion. So it is important to get that help, that psychological counseling, which help the dust to settle. The person is like caught up in a kind of weed of dust and what have you. So for that to settle, for them to find some safe space to occupy, moving onwards, then that help is very important.
Yeah.
But at least in the absence of counseling, because not everyone is able to access, this professional help, it is good to get someone they can lean on, a real human being who understands, who can tell them it is okay, you can move forward. Yes, that was a loss, but there must be another chance. And I believe that is what Rosie got, and she's able to sit here and talk about her loss. So that listening, a listening ear, a shoulder to lean on, is always very critical at such a time. And that is what many people probably do not know how to give. And they even wonder, where am I giving that support? I mean, there was nothing. We didn't even know that she was expecting a baby in the first place. And so that kind of taking it lightly, or someone doesn't show like they care or they understand, is what makes things worse for the person who has experienced the loss. Yeah.
Wow. And I think it's almost a calling to anyone who is going through a difficult time, especially when it comes to pregnancy loss, to reach out and be open rather than hold it in and not talk to anyone. So thank you so much, Jane, for sharing that with us. And maybe coming back to you, Rosie. Yes. So off air, we were having a conversation because when we look at the people who have gone through pregnancy loss, there's always the feelings that accompany it. Some people are angry, some people are grieving. And I think some people now blame themselves. How was that for you? You know, coming from even the point of what the doctor said was the cause of it. How did you handle it? And what was the feeling that was associated with you losing these pregnancies?
I think the biggest one for me, of course, there was the feeling I was sad.
Yeah.
That's my first reaction was, and miscarriage for me didn't happen. It doesn't happen once. You see, maybe it begins with spotting, and then it goes to bleeding, and then it goes to now losing the child altogether. But of course, you try to help. Like the last month one, this recent pregnancy, I started spotting. Of course, on Sunday, from the pulpit, started spotting. So I went to the hospital. I was given drugs to keep the pregnancy. But now, in the midst of taking those drugs, we moved from now the stage of spotting to bleeding. And then from bleeding, at some point I knew there's no hope here. Because when I talked to the doctor, he was like, no, those drugs are enough. Like there's nothing more they can do. He was trying to encourage, but I could tell, in other words, there's nothing more we can do. This is what you have. And I knew. So for me, because of course, as a mother, I wanted to understand, why am I losing my baby? Why am I losing this? I have been praying, I have been sleeping, what is it? So the cause, of course, they say it's strained, So I think that stuck with me. And throughout, I was thinking, what did I do? Why am I a careless mother? Why did I go to work? Why did I go? Why did I do it? I had a lot of self-blame on myself. And sometimes it would go to a point that I think the first 1 week it was difficult. I would cry. I would just, you wake up, you have a big stomach, but there's no baby.
Oh.
And it's a reality out there. You may look, you're fine, but you wake up in the morning, you have a big stomach and there's no baby. You have to take care of yourself because you see you've just miscarried, so you are not fine, so you have to take care of yourself. So even when I'm talking to somebody about it, when I was talking to someone that because I needed healing, when I was talking to my husband about it, I'm talking to him and he's listening, and I also know that he's grieving or mourning the loss of the baby. I think the biggest part was, as a mother, I felt like a failure. I did not do what other mothers do, or there's just something that I did not do.
Yeah.
So that was the initial feelings of failure and self blame. You needed to sleep, you needed to take leave, you needed to blah blah, and so on and so forth. But then, of course, went through that stage and got to a point where I accepted, because you see, I'm a mother of 4 other children. I don't see anything, looking back, I don't see anything different that I did, any strenuous work I did that was more than that.
Sure.
Yeah. So I moved on and say I accepted that it actually happened.
Yeah.
But my acceptance came from the point of, by the way, when I was going through that tough time, other people would want to be talked to or to listen to someone. For me, I just went to God, because my first experience talking to people made it worse.
Oh.
So I went and I prayed. I would cry and pray and tell God, if you cannot hear what I am saying, at least see my tears.
Yeah.
And I tell you, I kid you not, that gave me a lot of peace.
Wow.
And it brought me to the place of acceptance and knowing that, one who gives life, it's God.
It's him.
Yes, life and death are in the hands of God.
Yeah.
There is no life that would ever be lost without God being involved.
Oh, yes.
So if He has allowed it, then He will give me the grace to go through it. And then the other question I was asking myself, why me? And then I got to a point of, I have been asking God, why me? So I expect this to happen to who? So I told God, please give me the grace then to go through this
Yes.
to end. Yeah.
Wow, that's beautiful. That's a testimony in itself. Because I mean, it's a whole process.
Yeah.
And maybe, Jane, when you were talking, you brought out something very important about how the doctor delivered the message, the question of what happened, what led to the loss of this pregnancy. And maybe, Jane, you can shed light to maybe even a doctor who is watching us today on how then should a doctor deliver such sensitive information to a patient.
Wow, that's I like that. I like saying that's a very important observation that you have made there. Yes, psychologists believe that the way news is delivered or broken is as important as the content itself. So the how is as important as what. What am I delivering? So the method of giving or breaking such news, any news that is not so welcome, that is not good to the ears, not something you'd really want to hear any given day of our lives, should be broken or should be delivered very carefully. The reason is because that is a moment that the recipient of the information, in this case, Lozi, the way she received the news, is going to be thrown into confusion. And so to ease that moment, to ease the moving forward, it is always good to be careful. And it is recommended that sad news or news that is not welcome is delivered in reasonable pieces and intervals. Like probably if I were to break news to Rosie about the same, it would have been important, first of all, to find out how is there anything you feel right now, maybe medically speaking, Is there pain anywhere? Then move her to, this is what the scan indicates. This is what we see. And normally this is not a very good sign, but let's talk about it now. And that just breaking, that interval is very important because it gives the person receiving the news the opportunity even to process, yes, this is what is coming on. So they can already, kind of fill up some gaps for themselves. And eventually, we actually have lost the baby. And I need to put myself in it. We have lost the baby. That is already, that's very important because I'm saying, I am bearing with you. I am with you. I can understand. I mean, these shoes must really be big, or pinching. So now that is the breaking of the news. And as Lucy was saying, immediately after, the person does not know what to do. It is also important to find out what support do they have around. Who would they like to be there, even then as the information is being delivered? And that makes it easier because Lucy would know she's not the only one who have had that. She has someone else to counter check with. And what did you hear? And what did the doctor say? Or what did that person say? So it diffuses the intensity. Well, sometimes it's difficult even to verify this very thing. But the truth is, it is good to break the news with the importance, with the kind of like caring that is required. Because this is loss. Actually, a miscarriage, even 1 month, even before we knew it, it brings a sense of loss. And I guess with our people out there in the general population, may probably not know how to handle the person who have had a miscarriage. That is the first confusion. What do we tell her? Do we tell her pole sana? Do we tell her we are sorry? Do we tell her don't worry? I mean, normally we don't have words, but probably it is to the benefit of the viewer at this time to realize that it is also important to keep quiet and listen to what the person has to say. Because she is looking for someone to tell the story. And when no one seems to be listening or to be caring to listen, listening is a skill. Actually, when people listen to us, whether we are talking something of substance or not, it is very therapeutic. So it is important to listen to her perspective, to her side of the story, without putting in curiosity. The curiosity that killed the cat. Like, oh, what happened? What did the doctor say? Oh, what did you do? Okay. And now what? Are you ever going to get another baby? That kind of loaded curiosity is not good for a person who has lost, a baby through miscarriage or stillbirth or just born. It's not a good way of responding. And maybe that's why we need many more of this so that our people can get the information.
Wow. That was really profound. Thank you so much for bringing that out, because I remember reading an article and it would say, especially when someone is dealing with grief or a loss, sometimes just being silent and giving them a hug and just being silent sometimes is the best thing that you can do for them. So dear viewers, we'll be taking a really short break, but when we get back, the conversation is still ongoing. So send in your questions and let's continue to have this discussion on emotional healing after a pregnancy loss.
Hope TV is where you look and live, with an excellent selection of the best Christian programming consisting of local and international content of inspirational stories, talk shows, Bible commentary, youth, health shows, children entertainment, contemporary gospel music, extended times of worship, live broadcast, news, movies, drama, Christian ministry programs, and so much more. Hope TV is another quality service from Christ is the Answer Ministries with over 45% of authentic and credible local content every week. Hope TV is a sister station to Hope FM, Kenya's leading Christian radio station with footprints across the country. Tune in to Hope TV, where you look and live.
Going back to the heart of worship.
Whether up the mountain or down the valley, we were created to worship God.
Enjoy carefully selected worship music every Wednesday all day long.
Oh, I will sing of the goodness of God. Miracles happen when you move.
We take it a notch higher with more worship music.
Every Wednesday,
Is Worship Wednesday.
only on Hope FM. Listen and live.
Welcome back. My name is Beatrice Watare, and with me are two amazing women. I have Rose Talwa, who goes by the name Rosie. So just keep remembering that, who is a mother of 4 and who has also unfortunately lost 2 pregnancies. That is in 2019 and last month, actually. And then we also have Jane Gatia, who is a counseling psychologist, who is also very passionate about mental health. Karibuni tena sana. And let's continue with this conversation. And just before the break, I was thinking about the siblings, especially now that you've mentioned that you have 4 children, and this was actually the 3rd born, that is the first pregnancy loss. So how was it breaking this news to the siblings?
The difficult part was my firstborn is 15 years old,
Okay.
and so he was the most difficult one to talk to about.
Yeah.
That we were expecting a baby and he's not here anymore. The others are 5 years and below. Of course, they knew. They would see mommy's tummy is big,
Yeah.
and they keep on saying, because we tell them babies come from mommy's stomach. So they knew somehow there's a baby coming, our brother or sister. And we keep on asking, you do you want a baby sister or baby brother? And so breaking news to the firstborn was tough, but what happened is, because he was in school, so he was not there during that tough time, that when I was crying and going through the motions.
Yeah.
But a week later, the father went to school and met him and talked to him prior. And then now the second time is when we went and had a chat with him and talked that this has happened again, because the first one he also knew, because he's a big one.
Yeah.
It was, I think it was tough discussing. It has always been tough discussing pregnancy loss with him particularly, because 2019 he was 11 and now he is 15. But this one seemed to be easier for him.
Yeah.
Because I think his response, the first response was, "Oh, what did you do? You went jumping again," or something like that. But then he was like, he actually told me, children come from God. We might not know when, but I don't know what to say. What does daddy think? And we didn't have that conversation again. So we keep on bringing it up to find out whether there's anything that may, if he's battling anything about it. For now, I don't think I've not seen any sign of him battling or feeling or hating God. I fear that he would develop a certain bitterness towards God, because why is my sibling, something like that. Yeah, so it was like that for the first. He's the most difficult. These other ones, we necessarily did not tell them that we've lost the pregnancy. We keep on telling them the baby in mommy's stomach will eventually come. the baby will come. Because now, how do you tell a 3-year-old that you have miscarried? I don't know, maybe Grace will help me. But this far, truth be told, we have
Yes.
not had that conversation with them.
Yes.
Yes.
And maybe Jane can also shed light on, when we have an expert and ground.
Ground.
I love to merge the two.
Yeah.
And maybe she can also tell us, because maybe someone is watching and they're struggling to even deliver the news to the siblings of the child who, just went to be with the Lord. So maybe you can shed light on the proper way to deliver the news to the siblings.
Okay. And I thank God, I think the moment is getting a bit lighter. Talking to the siblings about the loss of the expected sibling and a baby to the parents. Yes, based on the age of the child, we break news and use words that the child can comprehend.
Right.
And when Rosie talks about 3-year-old, that's too young.
Yeah.
We don't really have a proper language to explain. But if the child asked what happened to the baby that was in the stomach, that's the language, the child language, in the stomach, where is the baby? Where did you take the baby? Probably that is the opportunity and the best one to explain to the very young ones that actually the baby did not grow and will not grow anymore. The baby came out before they could get to the age of being born.
Yeah.
And probably also looking for words to use so that it doesn't look like it is mommy who pushed the baby out or forced the baby out before they could be born, or didn't like the baby, because this child can actually preconceive very many ideas. They are understanding. And the concept we are discussing of miscarriage is very abstract. It is such an abstract concept for a young child. So I think we're using the language that the child understands at their age. The way the news was broken to the older one, 15-year-old, is totally different. Because he knows the biology. He understands that there could be miscarriage and, he can even Google and all that. So the language spoken there is an adult language. But younger ones, based on their age, we always check the age of the child and then address the question that the child has asked. We need not complicate anything. We need not use very complicated language and concepts that the child cannot be able to make sense out of it. So we address that particular question one at a time. The child may stay for a while, many days, many weeks, and come and ask again, Mommy, what did you say happened to the baby? Are we still waiting for the baby? That's now at a different level. And it is good to remind the child what you told them or just put it in the way that they can understand at that level. Some days in the future, they will understand what actually happened to mommy or to mom and dad with that child that we are expecting, who could have been my sister or my brother 10 years ago. Because they'll go to school and they'll learn things. They understand. And that time they don't have to come back and ask the same question. So we work with the baby, we use the language, and we should not tell a lie. Yes, children. I'm passionate about children, apparently. I'm also, the other side of me is a child psychologist. So I do a lot of that. I counsel children, and it is very confusing for the child later to discover. And then they keep asking, so who is telling the truth here? Is it the teacher? Is it my mom or my dad? Is it the Sunday school teacher? And all that. So that can create more confusion. So let the truth be told to the child, but in the language and words that are selective, well selected, to make the child understand something, even if it's a dot. The rest, they will understand in the future. Yeah.
That's amazing. And, I was listening to Rosie, you mentioning that even your own child saying that children come from God. I mean, it makes me believe that God has a way of also strengthening the children, even when they may not necessarily know what they're saying. It somehow has a very good effect on them. And maybe now, I feel that maybe there's a woman watching who has been through these losses, or maybe who has experienced it recently. From where you're seated, even being able to share this testimony with us today, what would you say to this woman who is still struggling, even probably blaming themselves for the loss?
I might not have much to say to them because in saying what they need to do, maybe I would hurt them more. In fact, allow me to say that as we comfort even those, and Daktari has alluded to it, sometimes ministry of presence is what they need more than the words. And I think when we come out to share or talk to people that are going through loss of pregnancy, especially in the first trimester, everybody has their own opinion. And they will tell you, oh, it was just blood, you will heal. Oh, maybe you don't know what God was protecting you from. Maybe that child was not going to be blah, blah, and all those kind of things. And so, or some of us would be very churchy and come and tell you it is well. I think a mother going through that season, whether the pregnancy was 2 weeks or it was 9 months, I have lost. At that point, I need no, don't tell me it is well, because it is not. Maybe it shall be well, but for now, it is not well. To you, it was just blood. To me, it was a child. I carried, I puked, I went through all those things. I went through emotions. I tested, it was there. The heartbeat was there. Don't tell me it was just blood. 3, even me, I went through. You know, that was you. It has, you'd see you sharing your experience with me because you've lost a pregnancy. Also, it is okay, but not at that very moment, maybe later. So there's a mother probably who has gone through it and they're looking at me and I want to tell them something. For me, I would say, cling on God. That is the only person that understands you. For me, cling on God. If you feel like crying, cry. If however you express your emotions, if it's writing, write. If it's talking, talk. Look for somebody and talk to them. Maybe talk to the father of the child or somebody that you can trust. Talk to them. That's what I would talk. Cry it out. Cry. Feel the pain. Let nobody deceive you. Loss is loss, as Daktari has said. For me, it's go through the process, and we all mourn differently. Allow yourself to mourn. It's okay to mourn. It is not well, but it shall be well. It is not well, it shall be well. As you, and then finally, it's, you will get there, probably you are not there. Accept that you've actually, the baby is normal. The giver of life has allowed it to happen. I don't want to say he has better plans. That's not what I want to say, but allow me to say that he allowed it to happen. Just cling on him. He will give you the grace to go through that process, and it will end. And for sure, he will restore you. That is the confidence we have in God. Yes.
I think it's the very first time I have had someone being so real and bringing out the fact that this is real pain. And we cannot pray it away. We can pray for strength,
Yes.
but we can't really pray the pain away. And sometimes the best thing is to go through it. When you're in the middle of a fire, you can't stop there. You have to keep moving. So thank you so much for sharing that. And maybe, Jane, you may shed light on the issue of maybe when you're counseling a couple, how does the process look like for grieving parents?
Yes, counseling a couple has its own dynamics, but in the context of loss and miscarriage or loss of a baby, it means so much to that couple. Whether they are married or not married, the thing is, they were expecting a child or a baby for that matter. So counseling in that sense will take the dynamics of what did it mean? What does it mean to the mother? What does it mean to the father? What were the expectations they are in? What is it you had done as you wait for the baby. You know, some of the parents, if they are together especially, will want to even search the name early enough. Where do we want the baby to be born in terms of the hospital? What clothes do we want? If it's baby boy, baby girl, what kind of shopping do we have? Or do we want to do? What is the budget like? And all that. How do we prepare other children just in case there are other children? So there are always those dynamics. And every parent has expectations and plans for the baby. So all those have to be addressed. It's like putting the person in the deep end, because it's unless the pain can be experienced in fullness that the person can take responsibility to want to get out of that. Nobody wants to stay in pain. So the reason behind probably taking the couple there is just to get them to own up. It is very important that we are able to accept that the reality has happened. The truth is we have lost the baby. It isn't a walk in the park. It's not a cup of tea or a glass of water like Rosie is sipping, probably because of the thirst of the imagination. Yes, so it is never such a comfortable space to occupy. So it is good that they own up, they accept together. You know, it's like shared grief somehow. Maybe one may never exactly feel like the other, but when grief is shared in that setting of the couple is together, yes, we are the ones who have experienced the loss and we accept and we want to move on. It also becomes easier for, you know, the couple to find a support system. So during couple counseling, there's also the initiative of what is your support system? How do you want to move on? If one of you was working, do you want to support them to get back to work? Do you want to support them to be in a different environment? So that is kind of like also shared, you know, moving forward, finding support system together, being able to encourage one another, and even them away from counseling, being empowered to talk about it. It is important that they also talk away. Remember, away from counseling. Remember, counseling is not a full-time and it's not an everyday thing. It is kind of to empower, to help the person to own up, to go through the grieving process. Because the truth is, they will have to mourn. Just like anyone else, just like in any other loss. So it comes in stages. It is a process. It is not an event. So that is a journey that two people are better. Like we like saying, two are better than one. So when they are together, they are able to pray together. If they are praying couple, that is, and they are able to share their feelings and they know that they are not alone in this. And actually, if their children who can understand, they also need to be involved. It can turn out even to be family counseling, whereby even other members of the family, other children are pulled into it, and now they can be able to mourn as a family so that no one is left out of the circle. And then it gets easier, and each one of them know that they are not alone. Yeah.
Wow. And I think what I'm also getting is that you can't really put a time to the grieving period of time, because I think everyone is going to process it differently. Because today I was watching a video just checking on the success stories of even people who have dealt with pregnancy loss, and you find that we have even people who ask you, it's been a year, it's been 2 years, why are you still grieving this same thing? And I think it is really important to bring out the fact that you cannot really put a timeline to anyone who is grieving anything. And I think even for you, having been there, having experienced that, I don't know how that looked for you. Did you have to maybe say, now I have to finish the grieving, or how did you take the process a day at a time?
The people grieve and mourn differently.
Yeah.
and just as you've said, that there are some people who will talk longer than others.
Mm.
For me, this the last month's pregnancy, I think, as I said, I think God had prepared me for it
Mm.
because it went in sequence. It was not like the other one. Of course, it was the first one. It went. I just started bleeding, and very quickly things moved very quickly.
Mm.
The whole thing was out.
Yeah.
This one, there was spotting,
Mm.
going to the hospital,
Mm.
being given drugs, and then the spotting increased each day. And then there was now the bleeding. So when you move from using liner to pads,
Mm.
you realize here, so it's
Yeah.
not going to be well.
Mm.
So for me, by Wednesday, I knew there's no turning back. And I had agreed, I told God, east or west, you are still my God.
Yeah.
There's a scripture in Job, and I don't mean to be to preach, but there's a scripture in Job, I think
Yes.
chapter 13, where Job, is it 13, where Job answers his friends who are telling him, this is going through your life because you are going through this because of that and because of sin, you must have sinned, and all those things.
Right.
But Job turned to them and said, even though you slay me, yet I will worship you. So that is the scripture that I ran with. I told
Wow.
God, we have moved from spotting, now we are bleeding.
Yeah.
I am still taking drugs. God, whether you save this pregnancy or not, I will still stick with you.
Mm.
So for me, that is how I handled it. Because I don't think during that time anybody understands you. In fact, for me, because I have other children, people will tell you like, but Rosie, you have other children. You know, that's what people will probably say. You have other children, or you are fertile. You still conceive again and give birth. I don't want to hear those things. So for me, I retreat with God, and I want God to give me that peace and to help me go through the process. So that's how I went. Of course, there was the place of denial,
Yeah.
complete denial. And then when I accepted, then life became easier for me.
Mm.
So people got to know when the actual miscarriage has happened.
Mm.
Felt like, Rosie, you are healing too quickly. You've actually healed. You have not mourned.
Mm.
Are you depressed or something? You know, so the process is different for every person, depending on how they process things or their personalities or
Yeah.
their upbringing, and so on and so forth.
Mm.
But for me, I think my relationship with God does not allow me to doubt Him.
Wow.
It does not allow me to look at anything as from the devil's perspective, or to think,
Oh.
God, you don't like me, or why me, or any of those things. So for me, the process is, let God has allowed me to go through the process.
Mm.
And He has done it in a manner that I've also accepted. It's not a walk in the park. I don't feel nice. In fact, me, I had already had the due date. I had chosen the hospital. I had the name of the baby and all those things that Dr. is talking about. I had kept them. Now the trouble was for me now to, and I still have them to date. The trouble was now to get over it, which I want to say, by the grace of God, even though you slay me, that is the covenant I have with my God.
Wow.
But me, I don't know how non-believers go through trouble, but that's how I go through. God, even though you slay me, yet
Mm.
I shall worship you.
Yeah.
Yes,
And you just reminded me of the verse when Job said, the Lord gives, the Lord takes.
that's how.
And I will still praise him.
Yes,
That is so beautiful.
Yes.
That is so, so beautiful. Because I think sometimes we make our relationship with God transactional. In a way, it's like, I'm blessing you so you can do this for me. And if you don't do this for me, then problem, you know. But I think that attitude of God, whether or not this works out the way I want it to, I believe that you're a good God, and that's all that matters. So allow me, maybe in the few minutes that we have, to just read some comments from people, you know, tuned in and who are watching even live on YouTube. I see Brian Waweru, who is tuning from Kilimani. Peter Kamiti, Madam Swala is really strong. Watching from Limuru, anasema great show. Mary McKenna, Madam Swala, you are a strong lady. Keep it up and keep going. I see Munano Lucy saying thank you. Rev Rose, I think they know you from that angle for allowing yourself to be vulnerable. You're great encouragement to the body of Christ. I also see Mary McKenna saying, Madam Jane, kudos for giving very important tips on how to break the news after the miscarriage, stillbirth, and how to handle the situation, which needs a lot of empathy. And I also see Dr. Charity Minor, who is saying, God bless you. Rosie, for allowing God to use you. I think this has been a beautiful conversation, and I'm really grateful for you just coming through to share your story, and also Madam Jane for just shedding the light on what we need to know pertaining how to to handle people who are going through such difficulties. And maybe just as we conclude, Madam Jane, you can also bring out this aspect of the male, the father figures, because I think nothing much is said about them, and I believe that some of them grieve pain as well. So how can they also handle the situation? Who do they need to talk to? How do they also help themselves in that situation?
Wow, that's a good one.
Yeah.
And as I get to the male factor in the event of miscarriage and loss of a baby, it is important that I also point out that this notion of time with time you'll heal, time is a healer. That's a no. Time is not a healer, and will never be. It is the things that the person does or get involved in that probably bring the healing. As Lozi was saying, some people think she's healed so fast, and I mean, she's not mourning, but it is the things that she's doing that are helping her to make that baby step and move out of that space, move out of that box, and step out. So the things that people do when they are in trouble, like loss and miscarriage and stuff like that, it is very important that we are able to get support system. I can hear with Lozi, there was definitely a very powerful, strong support system that came up. Could also have been from her spouse. But then the issue of men and miscarriage. Yes, if the man is involved, if the father of the unborn baby unfortunately lost through a miscarriage is involved and is there and is concerned, them too need support. They also need to talk. And that's why we talked about couple counseling at some point, because the assumption is the couple is the mother and the father of the baby to be. That would have been anyway. So men too need to talk. African men sometimes have difficulties mourning or showing that they are really, going through loss and even tears. I don't know, they are not supposed to come out. Now, I think that's in the old school and should be left in the parking lot. All human beings suffer loss when it happens, and we all have emotions. So fathers out there, I feel like speaking to you that you also need to express yourselves. Talk about what you feel, because men have feelings. Yeah, they need to be expressed. They need to be listened to. They need to be heard. And someone need also to be by their side. Maybe another man, maybe, when someone is on their wives, someone else need to come by. But I guess African men especially, I'm an African woman, I respect the African culture and the African man. But it is high time we realize that men too need support. And that also goes for even when we've lost, even an adult person, a child that was there and running about, very little come by for the man.
Sure.
Yes, and we are very quick to rush to the mother. But we forget, without that father, there's a father somewhere. If they come out, if they own up, let them also get support. So that it is shared grief, shared in quotes and quotes, and they can feel they're walking a similar journey. The journey isn't very interesting, but it can be negotiated.
Sure.
It is a process And that process has bumps, valleys, and mountains, but it can be done with the support that we are talking about.
Wow.
Yeah.
That's really beautiful. And time is far much spent, but allow me maybe to direct this question to Rosie. There's a lady who has told us that I went through the same last month. I lost a child at birth. The pain is unbearable. Even now, I'm still mourning. Pole sana. And I also see, kindly let us know the responsibility of the church, apart from prayer, in as much as people suffering from pregnancy loss are concerned. So maybe you can highlight that briefly.
The responsibility of the church.
Yes, apart from prayer, with relation to people who have gone through pregnancy loss.
As a church, we offer counseling.
Okay.
Beyond prayer, of course, the loss, it's pain. Somebody is going through pain,
Yeah.
and you cannot pray pain out. You can only pray for peace through the pain.
Yes.
You can't switch off the fire and you are in it.
Mm.
So since this is a fire that we can't switch off, we pray for peace throughout the fire, but then we need to walk with this person. So that person can go to church and get counseling. And at CITAM, in all our CITAM assemblies, we offer free counseling. There's counseling, pastoral counseling, and where there need for psychological counseling, then we do refer. So that person can seek help, yes, in our churches.
Oh, wow.
Yeah.
Thank you. Thank you so much for sharing that. Our time is actually up. Way past, the time. I was telling my producer earlier on, we need more hours for this show. But it's been really captivating. And personally, I've gotten to learn so many lessons. And I believe my biggest takeaway is that it's okay to mourn. It's okay to feel the pain. It's okay to, admit that you're in pain and something bad has happened. It's okay to take the time to mourn. It's okay to cry. And it's also okay to ask for help. Reach out to people who you know can be your support system, people who can offer the ministry of presence and be there for you. Just know that God heals all wounds. He binds those wounds. He really, really does. And most importantly, he restores. So thank you so much, each and every person who has been tuned in. Thank you, each and every person who has contributed to the show today. And a big thank you to the wonderful ladies who have really made this amazing and possible. So my name is Beatrice Watare, and you've been watching Health Check. And I do believe that your life has been transformed in one way or another. And of course, we just want to say sorry and, just sending love to any mother who has had to go through this pregnancy loss journey. May God give you the healing that you need for this season of your life. Have a good night.